Every day, our feet carry us through life, supporting our weight, absorbing impact, and adapting to a multitude of surfaces. Yet, despite their incredible engineering, our feet are vulnerable to a range of problems that can significantly impact our daily lives. Plantar fasciitis. This occurs when a thick band of tissue on the bottom of your foot becomes inflamed and causes pain. The pain is usually worst when you first get out of bed in the morning. It happens when you put too much stress on your foot from running, standing too long, being overweight, having tight leg muscles, or having flat feet or high arches. The tissue gets small tears that cause sharp heel pain. Bunions. A bunion is a bump that grows on the side of your big toe joint. It makes your big toe point toward your other toes. This happens slowly over time because of genes you get from your family, wearing shoes that are too tight or have high heels, getting hurt,
Ouch!
or having arthritis. The bump can be painful, red, and swollen. Ingrown toenails. This is when the edge of your toenail grows into the skin around it instead of straight out. It usually happens to your big toe and can be very painful.
Ouch!
The main causes are cutting your nails too short or curved, wearing tight shoes, hurting curved nails that run in your family, or not keeping your feet clean. Heel spurs. A heel spur is a small piece of bone that grows on your heel bone. It usually happens along with plantar fasciitis. Your body grows this extra bone to try to fix damage from too much stress on your heel. Things that cause it include running and jumping a lot, wearing bad shoes, being overweight, getting older, and having foot problems. Athlete's foot. This is a fungus infection that makes your feet itchy, scaly, and cracked, especially between your toes. The fungus likes warm, wet places like locker rooms and pools. You can get it by walking barefoot where the fungus lives, touching infected skin, not keeping your feet clean and dry, or wearing shoes that don't let air in. Corns and calluses. These are thick, hard patches of skin that form when something rubs against your foot too much. Corns usually grow on your toes, and calluses grow on the bottom of your feet. They happen when your shoes don't fit right, you walk a lot, or you have flat feet or high arches. Flat feet. People with flat feet have no arch in their feet, so the whole bottom touches the ground. Some people are born this way, but it can also happen as you get older. If you get hurt, gain too much weight, or have certain diseases, it can make your feet hurt after walking and cause your legs to ache. Hammer toe, mallet toe, claw toe. These happen when your toe bends in the wrong place and gets stuck that way, making it look like a hammer or claw. The main causes are wearing tight shoes, having weak or tight muscles in your toes, getting hurt, having arthritis, or being born with toe problems. Toenail fungus. This infection makes your toenails thick, yellow, or brown and crumbly. You can get it from walking barefoot in places like pools or gym showers where fungus lives. People with diabetes or weak immune systems get it more often. It spreads easily in warm, wet places. Blisters. Blisters are bubbles of fluid under your skin that form when something rubs against it too much. They usually happen when you wear new shoes, walk or run for a long time, or your feet get sweaty. If they break open, they can get infected. Metatarsalgia. This is pain and swelling in the ball of your foot, the part behind your toes. It happens from doing high impact sports, wearing shoes that don't fit right, or having other foot problems like bunions. It feels like you're walking on a pebble. Morton's neuroma. This is when the tissue around a nerve in your foot gets thick and painful, usually between your third and fourth toes. It feels like you have a rock in your shoe. It's caused by wearing tight or high-heeled shoes, doing activities that put pressure on your feet, or having other foot problems. Gout. Gout is a type of arthritis that causes sudden, severe pain in
Ouch!
your joints, especially your big toe. It happens when your body has too much uric acid, which forms crystals in your joints. Eating certain foods, drinking alcohol, taking some medicines, and your genes can cause it. Sesamoiditis. This is when two small bones under your big toe get inflamed and hurt. It usually happens to people who do activities that put a lot of pressure on the front of their feet, like running, dancing, or jumping. Diabetic foot problems. People with diabetes can lose feeling in their feet and get sores that don't heal well. This happens because high blood sugar damages nerves and blood vessels. Without proper care, these sores can become serious infections. Plantar warts. These are small, rough bumps on the bottom of your feet caused by a virus. You can get the virus by walking barefoot where infected people have walked. The warts can be painful and have tiny black dots in them. Nerve damage in feet. This happens when the nerves in your feet get damaged, causing numbness, tingling, or pain. Diabetes is the most common cause, but it can also come from drinking too much alcohol, not getting enough vitamins or taking certain medicines. Achilles tendon problems. The Achilles tendon connects your calf muscle to your heel bone. When it gets inflamed, it causes pain in the
Ouch!
back of your heel. This happens from doing too much exercise, having tight calf muscles, or wearing bad shoes. Arthritis in feet. Arthritis makes the joints in your feet
Ouch!
painful, stiff, and swollen. It can happen from normal wear and tear as you get older, or from diseases that make your body attack its joints. Tarsal tunnel syndrome. This happens when a nerve near your ankle gets squeezed, causing tingling, numbness, or pain in your
Ouch!
foot. It can be caused by injuries, swelling, flat feet, or other health problems. Bursitis. Bursitis is when small, fluid filled sacs in your foot become inflamed. These sacs help your joints move smoothly, but when they swell up, they cause pain and stiffness. It happens from doing the same movements over and over or from injuries.